We are back on Morning Line. Thanks for joining us. Talking about heart health this morning. The American Heart Association, of course, Go Red all this month. It's American Heart Month. Taking care of yourself. If you want to join in the conversation, 737-7587. You're welcome to call. Dr. Joshua Beckman's with us, Director of Vascular Medicine over at Vanderbilt, and just talking about the broad range of topics under the heart health umbrella. During the break, you were saying it's important to remind folks, again, heart disease is the #1 killer of both men and women.
That's right.
But you want to make an emphasis especially for women.
Yeah, I think that men already know that heart disease is their #1 killer. That's a well-recognized sort of fact in society. But women, I think, worry about a variety of other health issues.
Breast cancer,
for example, ovarian cancer,
sure.
Cancer in general, which, by the way, I don't want to minimize. But heart disease is the #1 killer. 1 in 3 women will die of heart disease.
1 in 3. All right.
1 in 3.
Again, and because they don't have the focus on that, your point would be that if they followed it more, it's preventable. They could take more steps to address it.
We have ways to reduce that risk and have them live longer, healthier, more productive lives.
Okay. Let's just talk then, and again, we can take your calls. The risk factors then for heart disease, I guess we've touched on a few of them. Okay, cholesterol level.
Yep.
Smoking.
Smoking is probably among the worst.
The worst. Smoking, cholesterol level, lack of exercise, or body weight. Does body weight factor in?
It does, probably because it brings along with it other risk factors like high blood pressure. It alters your cholesterol, things like that.
So and I was going to hit on high blood pressure.
That's right.
That's the point being, if you have a combination of high cholesterol and then your blood pressure's up high, so what do you have? You have your blood squeezing through these tight veins, can't make it through, and it's really pushing, and then what, eventually the arteries give way and you have a stroke or a heart attack? Yeah,
so the arteries change in response to being under high pressure all the time. So your blood vessels thicken and become stiffer tubes.
But what causes the higher blood pressure? I mean, okay, like for instance, I'll eat a piece of country ham, which I don't do anymore, and I get buzzing because of the salt. And it never used to affect me. Now it does. What the heck is that doing to cause my blood pressure? I mean, all of a sudden, what, are my veins constricting?
Well, actually, what I would say is you're overfilling with salt and water. Okay. So water follows salt, and if you have a really big salt meal, you're actually holding on to a lot more fluid, and you could think of it as your system is full. Your system, you're basically pumping into a relatively limited space. And so when you have the same amount of fluid going forward and the tubes are full, the pressure will be higher.
Okay.
But the short term is annoying and not good for you, but it's the long term that causes a problem because it can cause heart failure. It increases the shear stress across plaques that can cause a stroke. It can cause a heart attack. It can cause it is associated with the development of aneurysms. High blood pressure that's uncontrolled has a wide variety of bad effects. It can participate in kidney failure, all of these things. And so I'll be honest with you, nobody knows the exact mechanism of high blood pressure. It's been around, and we've known about it for decades.
Sure.
In fact, Franklin Delano Roosevelt probably died of high blood pressure. His blood pressure was close to 200 millimeters of mercury for years.
What's normal?
Normal now, the American Heart Association, the American College of Cardiology, most recently basically said that under 130/80 is normal.
Okay, so he was up at 200.
200, right? And he lived for a while, but you know he also suffered the consequences. You can't have high blood pressure that high that long without suffering some kind of adverse consequence.
Okay, and blood pressure again can be controlled.
Yeah,
you can try first without medicine, can't you? Maybe, or
and in fact, the best thing usually what we do is we discover people who are not at 200. We discover people who are just above, and so we recommend reductions in salt. Better diet. You want to make sure you have lots of colors in your diet, fruits and vegetables. You want to get exercise. You want to get enough sleep. Each one of these things is helpful and will reduce your blood pressure. And frankly, if you're having the bottle of wine every day, as you mentioned before, you want to cut that down too, because in some people, alcohol can raise blood pressure.
Let's take a call from, is it Barry? Good morning, Barry.
Hi, good morning.
Oh, it's Mary.
Thank you for taking my call.
Sure.
Yes, I have PVC. I was diagnosed about a year ago. I'm 41, and does that make me more at risk of having further heart disease or more at risk of having a heart attack in the future, or this is not related at all to any other heart problems?
Did your doctor find that because you were feeling these single skip beats?
I was, yes. And then also I was starting to feel like I was having pain in my jaw and like tingling usually my left arm. And it was really hard for me to breathe. So I ended up in the ER twice thinking that I was having a heart attack.
Oh, wow.
They
Wow.
sent me home telling me that I was just having some anxiety attack. And so eventually I just went to a cardiologist, and he ran a few tests, and he said that I just had like a textbook case of PVC.
So PVCs are premature.
Thank you, Mary.
Yeah. Premature ventricular contractions. So they're skip beats.
Okay.
Usually when they come on as single skip beats, it's not a big deal. It's pretty common. Some people can get them in response to caffeine. Some people get them when they get a virus and then it goes away. When they come on in series, and they happen a lot in a row, that could be an issue, and then you'd want to do a couple of tests, like maybe a sonogram of the heart, see how well the heart's pumping. And if the heart's pumping normally, PVCs aren't usually an issue. Sometimes in the right setting, in people with heart disease, they can be a problem. But it doesn't sound like, based on what Mary was saying in her visit to the doctor, that that's the case here.
Yeah, when it happens, I guess she described some of the symptoms. You feel can you feel your heart skip a beat?
You can. Lots of people feel that.
Wow. Really? Okay.
Yeah.
And it happens. It's not a
No, that's pretty routine. We see.
routine. Does it happen? Do most people, or is it? I mean, has it happened to me? Probably. I just haven't noticed.
So I would say this: it's very common.
Very common. Okay.
And it, you know, if you just ask around, lots of people will tell you they occasionally feel a skip beat. That's not
but
that.
again, it's not.
No, that's not a big deal.
And it's not. Is that the result of some kind of electrical thing, or I
Yeah.
mean, it's not just the rhythm of it, but it corrects itself. And
Yeah, so it's one skip beat. I mean, remember,
Oh, yeah.
60 beats a minute, 3,600 beats an hour. One skip beat's not a big deal.
Gosh, the heart's amazing. It's really about the size of your fist.
Mm-hmm.
This little thing is pumping all my life
That's right.
in my chest.
Yeah, more like 1 billion times.
And when you think about the way I have too, I suppose, we abuse our heart by not doing the best things for it. It's crazy. I mean, all it does is work for you. How about taking care of it for a while?
Well, you take it for granted.
You do.
I
You
know.
know what? So then when you get nailed, que sera, buddy. Take care of yourself. All right, let's go next to Todd. Todd, good morning. Hi, Todd.
Good morning, Nick, and good morning to you. Yes, there. I just got a quick question. When I was younger, I never had any blood pressure issues at all. And now that I've gotten a little older, my blood pressure was high, so he put me on propranolol, 40 milligrams twice a day. And I have chronic migraines also. Well, I went to the doctor a few weeks later, or a month or so later, and my blood pressure was 180 over 100, and he immediately doubled the propranolol from 40 milligram to 80 milligram. And I just wanted to kind of put that out to your guest to see what his
Sure.
opinion on that is and why maybe that's happening.
Okay.
And I thank you.
Thank
Thank
you.
you for your time.
Certainly, Todd.
So, look, Todd has high blood pressure, right? He's over the 130 over 80.
Yep.
And so I agree with your doctor. You have to be on medications to bring that blood pressure down. I think Todd's doctor chose the propranolol to help with both the migraines and the blood pressure. But there are now so many different medications that you could choose from, so that even if they get to a higher dose of propranolol and it doesn't meet the goal, you can add on a second medication. There are 5, 6, 7, 8 classes of high blood pressure medicine.
And in each class, several different varieties.
That's right.
Wow.
And so there should not be any difficulty in getting his blood pressure down. Now, I will say this. About 5% of the population, even when they take 3 medications, they still have high blood pressure. So we call that resistant high blood pressure, and then we begin to look for other hormonal causes that you can have. But that is the minority of people, and people shouldn't expect to walk into the office and have a hormonal cause. It's really rare in the general population. And then frankly, you know, it sounds like Todd is sort of in my age range. And
26, 27?
28, but thank you for saying.
All right.
And as we hit middle age, it becomes more and more common. You know, and by the time we're 70% of us have high blood pressure.
It's just one of those things that comes with age.
It comes with age. We stiffen, like our opinions.
Yep. That's a good point. Less likely to accept change. We'll take a break. We'll be back with more of your calls, more of our conversation with a good doctor right after this.